Today our class is about third part of breast, that is histology of breast and clinical anatomy of breast and self-examination of the breast. Histology, clinical anatomy and self-examination of the breast. These are today's topics. Before going to the class, please share the video with your friends and subscribe to our channel. Follow us in Instagram for notes. Okay, then coming to the histology. See, histology divides the breast into two parts, that is at resting phase and lactation phase. Resting phase and lactation phase. See, resting phase is before pregnancy time or before the lactation period, and lactation phase means at the time of lactation. Okay, that means giving milk to the baby. Okay, now coming to the resting phase. See, mammary gland contains many ducts. Here is the resting phase. This is the histology of resting phase. It contains many ducts. Okay, we can see many ducts in the histology of this breast in the resting phase, and stroma has connective tissues along with fat cells. Its stroma has connective tissues along with fat cells. These are connective tissues and fat cells, and here, see, and this is the lactation phase. So I will say again, here we can see the duct, there are number of ducts, and here ducts are very fewer, that means low, little low in number. Okay, next here we can see many connective tissues along with fat, and here we can see fat along with connective tissue but in fewer, little. Okay, next point, here we can see abundant interlobular connective tissues. See, each and every lobes we are having connective tissues, interlobular connective tissues, abundant, many interlobular connective tissues because it has many ducts. So here lesser interlobular connective tissues because there are a low number of ducts. Okay, next here we can see adipose tissues at a resting phase, and at the lactation phase adipose tissue is very low, fewer. Okay, these are the difference between this resting phase and lactation phase. And here the resting phase interlobular ducts are columnar epithelium, and coming to the lactation phase, it is low columnar epithelium, and coming to the lactation phase, it is tall columnar epithelium. Here it is low columnar epithelium, and here it is tall columnar epithelium. This is the difference between this resting phase and lactation phase. And here in the lactation phase, one more point, here we can see stratified columnar epithelium for bigger ducts. Okay, the bigger ducts are followed by stratified columnar epithelium. These are the difference between this resting phase and lactation phase. I repeat again, here in the resting phase ducts are more, and here ducts are less. Interlobular ducts are more, interlobular ducts are less, and here fat adipose tissue is more, and here is less. Here the low columnar epithelium, here it occupies tall columnar epithelium. These are main points regarding the histology of breast regarding resting phase and lactation phase. Now coming to the clinical anatomy, the most important concept of this entire breast is clinical anatomy and along with the self-examination. Now coming to the clinical anatomy, see upper quadrant, outer upper quadrant, that means here is the breast, these are the nipples, and it is the areolar connective tissue, it is nipple, and here we can see the tail of axillum, and here it is the upper lateral. See, this upper lateral, we call it as outer margin, outer quadrant, upper outer quadrants. This quadrant is the most common cause for carcinoma. Carcinoma occurs mostly at this place. Carcinoma occurs mostly at this site. Okay, next, incision of breast, that means while operating to this breast, incision of breast, that means cutting of breast takes place radially. Okay, radially from areolar region to the this part, because we cannot cut along with this nipple and areola. See, it is very wrong process, because if we cut it, it will tear more than, and it damages the lactiferous ducts and lactiferous sinus, and it may cause it does not secretes the milk. Okay, baby cannot suck the milk from this nipple if we cut along with this areola nipple. So the cut takes place at a radial. Okay, next, infiltration of lactiferous ducts. That means, see, cancer cells affects the infiltrate of suspensory ligaments. See, these ligaments helps the nipple to place in a certain position. While the cancer is affected, these cancer cells infiltrate the suspensory ligaments so that the nipples retracts. Retraction means, see, these are the nipples. Think that it is the nipples. So if the condition retraction occurs, the nipples are flattened like this. Nipples go inside. Nipple goes inside. This is called retraction of nipple. This is caused because of this. This is caused because of cancer. Okay. Next, coming to the next point. Because of this communication of super breast causes the medial. And one more point. This cancer of breast. See, the breast, the lymphatic drainage of the breast communicates with the all other parts of the body. That means the lymphatic drainage of the breast communicate with the pelvis region, or with the ureter region, or with the liver, or with the kidneys, or with the gallbladder, or with the femur. Okay, so the lymphatic drainage of the breast connects with the almost all the parts of the body. So if the cancer occurs to the breast, it may moves to the other parts of the body through lymphatic drainage. So breast cancer is very dangerous cancer if we neglect that problem in early stages. Okay, if we neglect the problem in early stages, it may cause to other organs cancer to other organs. Okay, so please be cautious about this. And next, this is all about the clinical anatomy of the breast. Now coming to the self-examination of the breast, that means to examine the breast cancer. Okay, see, the first thing, the breast cancer is most common for all age groups of females. Okay, breast cancer is common for females in all age groups. Now coming to the inspector self-examination, first we should examine the two breasts, whether the size of the breast is regular or irregular, same or not same. If the size increases of one breast, it may lead to cancer. So this is one symptom of that cancer. And a change in color of the skin of that breast, that is one more symptom. That means it changes to orange color. If it is the cancer breast, this is one breast, this is one more breast. If this breast is the cancer related breast, think that it is the cancer related breast. See, the size increases. There may be change in size. Okay, there may be change in color. Color means orange color. Okay, there may be change in size increases, color orange color. And retraction of nipples. That means I already told about the retraction of nipples. Nipples goes inside. So retraction of nipples, discharge from nipples on squeezing it. Okay, if we squeeze the nipple, there may be discharge from nipple. Next, these four are the main symptoms. And one more symptoms. See, these are the four quadrants of the breast. See, these are the four quadrants of the breast. So we have to palpate the breast. That means we have to press the breast with our thumb finger at of all the four sides, so that we can find whether there is any lump present on the quadrants of breast. Lump present on any quadrant is the main symptom for the cancer, breast cancer. Okay, these are the main symptoms of breast cancer. And in the breast cancer, it is very easy to examine whether there is a cancer or not. if we know about these symptoms, we can confirm that there is a breast cancer at that person, to that person. Okay, next, mammogram. Mammogram is an instrument used to find whether there is a cancer in the breast. Okay, it reveals the cancer cells, mass of cancer cells. Mammogram, mass of cancer cells in the breast. Okay, these are the things to examine the breast cancer. I will repeat again: palpation, size increases, size of breast increases, change in color to orange color, and a nipple gets retracted, and a discharge of, there may be discharge of nipple while squeezing the breast. Okay, these are the 5 main symptoms that we can examine that there is cancer of breast or not. And next we'll study about the breast studies. That means mastectomy, mastectomy. Mastectomy means there may be surgical removal of 1 or 2 breasts. Surgical removal of 1 or 2 breasts. And lumpectomy. Lumpectomy. See, I already told about what is lump. Lump means there is a, say, lump. Lump means kayam in Telugu. Okay, lump means kayam anta chudandi. That's we call it as lump. That means there is a, like tonsils. We can observe like tonsils at the position at the quadrants of that breast. So we call it a lump. Say, lumpectomy means surgical removal of lump from the breast. And the next one more is there, radial mastectomy. Radial mastectomy means it is the surgical removal of breast, but in the advanced condition. That means in the severe conditions. Okay, when the problem becomes advanced, when the cancer becomes enters into the advanced stage, we will do the radial mastectomy. Okay, mastectomy means surgical removal of 1 or 2 breasts. Lumpectomy means surgical removal of lump. Radial mastectomy means treatment for the advanced breast cancer. Okay, thank you all. This is our today's class. We have completed the breast concept of breast. From tomorrow we will go to another concept. Thank you all. And one more thing, this is our notes for today. Thank you all.